Understanding and treating diabetes. Hi, my name is Alina, and let me tell you a little bit about myself. I'm doing now a master's degree in applied nutrition from University of New England, and I also have a bachelor's degree in nutrition science from Purdue University. My work experience is I used to volunteer teaching children and adults in a low-income community in Los Angeles. I was teaching them how to prepare and how to eat healthy foods on a low budget. Um, I also do nutrition counseling for teens and adults about eating the right kind of food and incorporate a healthy lifestyle in preventing chronic diseases. So the learning objectives for today is to learn about diabetes, what are the causes and the health issues involved, identify what kind of food to keep at home and learn how to pre-prep meals, understand why being physically active is essential for improving diabetes, and practice meditation to help reduce stress and reduce diabetes. The topics for this discussion are what is diabetes, different types of diabetes, what are the symptoms of diabetes, how can I prevent or control diabetes, health issues due to diabetes, and solutions with food and exercise. So what is diabetes? There are two major types of diabetes. First one, it's called type 1 diabetes, which is actually an autoimmune disease. So the body does not make insulin at all. It's usually diagnosed as childhood. It has nothing to do with being overweight or obese or eating certain kinds of food. Is like I said, it's like an autoimmune disease. So only around 10% of people that have diabetes have type 1 diabetes. And they do need to inject insulin throughout the day because their body does not, their pancreas does not make insulin at all. Type 2 diabetes is most common in adults. It's a chronic condition that affects the ways the body processes blood sugar. The body does not produce enough insulin, or it resists insulin, called insulin resistance. So the body makes insulin, but not enough, or the body resists the insulin. So that's what type 2 diabetes is. And rates of diabetes are increasing in children and adults due to bad food choices, full of refined flour and other sugary foods and drinks. Another thing is being inactive. So today we're going to talk about type 2 diabetes, which is a lot more common than type 1 diabetes. Most people that are diagnosed with diabetes have type 2. So only 10% of diabetes people have type 1. The statistics in the US is according to the CDC, which is the Centers of Disease and Control Prevention. 32.2 million Americans have diabetes. 88 million Americans are pre-diabetic, and 89% of them were overweight, and 38% of them were physically inactive. So having such a big number of people, 32 million, is a lot. People that are diabetic and 88 million are pre-diabetic, meaning that they might have it in the future. So these numbers are really, really alarming. There's another stage before diabetic, it's called pre-diabetic. So there is also a stage before having type 2 diabetes called pre-diabetic. The average blood glucose is above normal levels, but not high enough to be type 2 diabetes. So the A1C levels should be between 5.7% and 6.4% for pre-diabetic. It starts with unhealthy eating and inactivity. And again, 88 million people in the US are pre-diabetic. So what is A1C? So A1C test is what is glycated hemoglobin, which is A1C. And it's a blood test. The A1C is a blood test, shows the average blood sugar levels within the last 3 months. So whatever we are eating the last 3 months, it shows, not the last 48 hours like glucose. So an A1C level below 5.7% is considered normal levels of glucose, which is also blood sugar. And that's where we want to be. We want to be below 5.7. An A1C level between 5.7 and 6.4 is considered pre-diabetic. And in this level, sometimes the doctor gives you medications and sometimes they don't. Usually if it's above 6.2, they usually start giving you medications, because then if they see an increase every year, it's not good. An A1C level of 6.5 and higher is considered diabetic, and this is when you really need to take medications because you have no other choice. You have to control the diabetes. So symptoms. What are the symptoms of being diabetic? Some of the symptoms are high blood levels of glucose, blood sugar, blurry vision, feeling fatigue, feeling thirst, so feeling thirsty all the time, also frequent urination, sores that do not heal as quickly as before, feeling nausea, vomiting, and also feeling hunger. So these are some of the symptoms of being diabetic. What are the causes of diabetes? So being overweight or obese, consuming low fiber foods or processed foods, consuming processed carbohydrates, inactivity, family history, and age. So 45 years and older are more prone to get diabetes than somebody who's younger. So the number one cause is actually being overweight or obese, and that's lack of eating the right kind of foods and eating too much of processed foods with low fiber foods that makes you gain weight, and also consuming the wrong kind of carbohydrates. So anything with white sugar and white flour makes the blood sugar spike up really fast. And of course, inactivity, so not being active at all, makes a difference, not just gaining weight, but also with diabetes. Family history is also, if your parents have it, then you most likely have a more chance of getting it than other people. And age, of course, 45 years or older, so it happens when people are getting older, usually. Even though we do start to seeing it in younger people, where they're obese or overweight. So testing for diabetes, fasting blood test from 100 to 125 milligram of blood glucose, that's pre-diabetic, and 126 milligram and above are diabetic. It is good to have blood tests at least once a year to check blood glucose levels, or more often, depends on your doctor's recommendations. Usually minimum is once a year, but sometimes your doctor wants to do it every 6 months or even more, depends on your blood sugar levels. So risk factors, foods. Processed carbohydrates are made from white flour, white sugar, that spike up the blood sugar. So these are foods that are stripped from most vitamins, minerals, and fiber, like white bread, crackers, muffin, cakes, pasta. So all the carbohydrates that are made from white flour and sugar, what happens is they're stripped from most of the vitamins and minerals and fiber, and it's basically eating like an empty calorie. So there's no benefits of eating these types of carbohydrates. Not only that, it kind of spikes up the blood sugar really high and then drops it down really quickly. So not only that it spikes up the blood sugar, but it has no benefits to eating that, and the body just stores it as fat. And not only that, sometimes it can even create inflammation. So it's really not healthy to eat any processed carbohydrates, and a lot of it is found in many items that people consume every day. So how much refined carbs do Americans consume? Americans are consuming 42% of their daily calories from refined carbohydrates. The amount of whole grains and fruits are only 9%, which should be the other way around. So all of our carbohydrates should come from whole grains like brown rice, whole wheat bread, and quinoa. So these whole grains have a lot more vitamins, minerals, fiber. They're not stripped out of everything. They don't make the blood sugar go high really fast. It's kind of raising it up steadily, and it stays the same. It doesn't go up and down really quickly. Plus, it has a lot of benefits because it has a lot of nutrients that our body needs. So it's actually good to eat those kinds of carbohydrates. So how does diabetes affect the body? Diabetes can affect the heart. It can affect the kidneys. It can affect the eyes. It can affect the nervous system. It can affect the skin. It can affect the brain for having depression, mood swings because of the blood sugar going up and down. And it also has a link to Alzheimer's disease. So it has many effects, bad effects on the body. Long-term effects are heart attack, stroke, hypertension, kidney disease, and at least 65% of people with diabetes die from heart attack or stroke. So diabetes itself doesn't make it hard, but the complications of having diabetes for a long time can affect many organs in our body, and then can create all these diseases that are really harmful for us. So it's better to try to prevent diabetes. It's better to change the way we're eating, the way our lifestyle is, so we can prevent all these diseases in the future. So we can prevent having that and actually reversing it and having a healthier lifestyle and losing weight, eating healthier food, having more energy, and feeling better. And of course, lowering our blood sugar.